Hi everybody, let's talk a little bit about Miotto Monday. Miotto Mondays are the surgery days, and I love helping my patients look their best. So that's the main goal. That's the goal of aesthetic surgery. Nobody wants to look different. Nobody wants to look weird. Nobody wants to look like anything happened. People like to look like themselves, but better, refreshed, beautiful, younger. And today we had, especially for guys, we had the number one surgery I do for men, which is eyelid surgery, then facelift surgeries as well. Let's talk a little bit about types of eyelid surgery. Hi everybody, Pretty Fab Fit NP. Hi. Wonderful. Christine is just joined. So this is my first live on Instagram. Never done it. So let's see how it goes. I would like to share with you a image so you can see what I mean when I talk about eyelid surgery and the different things I do. I'm not gonna show surgeries because some people don't like it. They feel it's gross to see blood and incisions. So I'm just going to maintain a little bit of less visibility of blood and sutures. So number one, lower eyelid surgery. When it is scarless eyelid surgery is when we do the lower eyelid bags. We trim the bags from the inside of the eye. That is called transconjunctival blepharoplasty, and is great for people that have bags under the eye. They have good skin. There is not a lot of skin excess, so there is no wrinkling of the skin, but there is bulging. So the eyes look tired, they look like puffy, they look like they have allergies, and patients don't like that. So take a look at this example here. Look at this bag on the lower eyelid where there is an arrow there. That is only bags. We don't have excess skin. So we are going to do a scarless eyelid surgery, scarless blepharoplasty. We go inside the eye, put a little cut there, trim the fat out. And for her, we transposed as well into the lower eyelid. So it looks good. When do we need to remove skin? When we smile, like me almost here, has a little bit of skin bulging up. So we put a subciliary incision under the eyelid, and that is actually done as a skin pinch, or we just dissect the skin and resect the excess. Very good for patients that have a little bit of lax muscle or lax skin. The incision gets really invisible and it looks pretty good once it's healed. Many times, hi Andrew, many times what we do with lower eyelid surgery, after we trim the bags, some patients have this area here really hollow, and we can see like the dark circle. When we have dark circles, what do? We release a ligament here. We can transpose the fat, so we can get the bags from here and put into the gap. And we can also do a little bit of fat grafting, which is wonderful because we are really replacing volume back to the lower eyelids. So let me show you here a little bit of that. Let's see. So look at this patient, okay? The first image is before surgery. Second image is after surgery. Before surgery, she has bags, but she has this dark circle around it. It's not really a dark circle, it's loss of volume. That's when we go there, we trim the bags, and then we put fat grafting around it to improve the loss of volume. And we all age by loss of volume. You can see her upper eyelids right here in this area here is hollow before surgery and is fuller after surgery. I also did fat grafting there. And the mid face, the cheeks, is a little fuller, not exaggerated, just enough. to bring her face back into a youthful place that it used to be. So that is when we do fat transfer. For her, I also did a little brow lift. So we kind of just open up the corner of the eye slightly, trim the skin that is excessive, both from the lower and the upper, and just reshape everything. Makes people look younger. Do you guys have questions about it? It's not going to be a long live, but I just want to show to you what is really important when we do facial rejuvenation surgery, especially the eyelids. We do not want to make people look weird. We want to make people look beautiful. That's why people come to me to look refreshed and not operated. Fat grafting needs to be done in a very meticulous way, so we don't have lumps and bumps and issues, all the crazy things that patients ask me. Oh, but fat grafts, I've seen online, I Googled, it's terrible, it creates a lot of problems. No, it doesn't. It's amazing. And when it's well placed, it looks like nothing ever happened, and it just looked rejuvenated. Also, when we do fat grafting, we kind of do a free lipo with it, because we always remove a little bit of fat from unwanted areas. We remove them with very, very fine cannulas. It's much finer than a liposuction cannula. And then we prepare it as the patient's own filler. It is kind of regenerative type of treatment. Dr. Tonnard is here, the creator of the fat grafting, my idol. That's how I do it, like Dr. Tonnard. He created the microfat and the nanofat, which is the best thing ever for fat grafting to the face and regenerative treatments. He does an amazing job in Belgium. If you are in Europe, you have to go see Dr. Tonnard. He's amazing. Also, when we are doing eyelid surgeries, how long does it take to go back to normal life? Usually, eyelid surgery, the downtime is about a week to 10 days. There are sutures here in the crease. You can see the patient here. You cannot see the scars because it's placed right here on top of the eye and under the lash line. When I do the brow lift, it goes right here into the hair inside. I do it endoscopically, and it heals into the creases of the eye. Yes, when you close your eyes and you get your magnifier mirror, yes, you're going to see the incision, but otherwise you will not see it. What to do to speed up healing? Icing. Follow the pre-op and the post-op instructions that we give to all patients, and relax. You need to take time to heal. If people want to do too much too soon, they can have a more lengthy recovery. So I think that's it. Nobody has questions today. Is it true hyaluronic acid helps with under eye hollowness? Yes, it is, if well placed. Anything that is creating volume on a face that has loss of volume can improve hollowness. So hyaluronic acid fillers, the right type, not super hydrophilic, the ones that don't absorb a lot of water, when placed right in the area of that gap right there, along the orbital rim and into the midface, can improve hollowness. But it needs to be a very small amount with the right filler and not done super often. Otherwise, it can cause visibility of the filler. You can cause this bluish tint called Tyndall effect. Very good question. I don't see any other question. Seems that everybody understands well what eyelid surgery is about. Well, how far out are you booked for appointments and also surgery schedule? My schedule is for consultations, we are booking for September. And for surgeries, I think it's about September, October, but a lot of people have booked for January and February because people like having surgeries in the winter. So we have some some space here and there, but I think January actually is one of the most booked months already. What I mean is hyaluronic acid that we purchase from the store. Oh no, okay. Hyaluronic acid topical creams, lotions, they do not penetrate the skin enough to improve under eye hollowness. They are just to hydrate the skin a little bit, and they do not improve the hollowness like hyaluronic acid filler that is injected in the eyelid. Wonderful. I want to be a doctor like you. It's wonderful. You just need to go to school for a long time. You do need to like to study, because that's a constant in our life. I like studying, so it's great, especially when I study things I like doing, like plastic surgery. All right, everybody, my first 15-minute live. I appreciate you all being here. It was fun. I'll do that more often. Miotto Mondays. Maybe I'll do that every Monday. Thank you. Have a good day.